Të dashur teleshikues të televizionit të shqiptarëve të Amerikës, në rubrikën tonë Fjala e Specialistit, siç kemi pasur specialistë të fushave të ndryshme, sot kemi një mjek. Ne jemi njohur me mjek të ndryshëm edhe shqiptar në emisionet tona me pyetje-përgjigje, por sot kemi një mjek të veçantë. Një mjek i cili ka reklamën e vet në televizionin ton, edhe pse vjen me origjinë nga Iraku, përsëri është i afërt me ju, është i afërt edhe me familjet shqiptare, pasi është një mjek i familjes. Hi, doctor. So we have here Dr. Mazen Alsaqa. Did I say it right?
Yes, you said it correct.
Okay, sir. So we want to know, just the audience, we have a lot of other doctors or dentists and other in our TV, but they want to know about something about you, about your work, about your experience. And I will start with a simple question. Can you tell me something about your background?
I graduated from medical school in 1999, and I came to the state 2009. So I have a lot of experience in medical treatment and management between different countries internationally and the United States. Then I got my degree and started working in this clinic in 2015.
15.
So we are here in this community since 2015.
Oh yeah, very good experience in different countries and different nationalities and
yes.
And the way of doing medicine. So how do you approach your relationship or your patient, somebody that comes for the first time in the clinic?
So this is what actually makes us unique here, because we treat everybody like a family. So everybody here gets a fair treatment, very close treatment or relationship. We love everyone from our patient. We try to give them the time they need and the time they spend with them. Everybody try to be friendly and try to help them in doing things. And that's actually what makes patients very happy coming to our practices, very useful when they come, because we try to help them with their life problem too. And the second thing, the variety of services that to provide in the practices, because here we do the electrocardiogram, which is for the heart. We have an X-ray machine, so we do X-ray machine. We do also procedures like we suture wounds and we open the sutures. We also try to do some cosmetic procedures for skin tags by freezing and also by thermal. So you can see between treating everybody as a family and the number of service and the skills that we have, it makes this practice very attractive for people to come back again.
How many nurses or doctors, or it's only you on this practice?
So it's one full-time doctor and another part-time doctor. She's a female doctor, and we have almost 4 or 5 staff people working here.
Oh, very, very good.
Yes.
So they are coming from different nationalities, I suppose, from the area.
Mostly, yes.
Okay. What kind of illnesses?
And we try to find Albanian lady too.
What kind of conditions or illnesses do you typically see in this practice?
So most of our patients see the regular internal medicine condition: diabetes, hypertension, a high cholesterol, and all the other medication for heart disease, heart failure. And we try to help everybody here by the treatment and by the counseling. So I have a special care manager that follow up with people and follow up on their care, that they take their medication, call them at home and see how they are doing with that. And also we try to draw blood here and try to check on them while they are here. So that's help us with the big picture inside.
So you send the blood to the laboratories?
Yes.
Okay.
Yes. But we draw the blood here. So we don't have to go to the hospital. They don't have to somewhere else.
That's very good. What the average age that you take care about from?
We take care from 17 years old to 99, 100 years old, if there's 100.
How do you handle a situation when a patient diagnosis or treatment plan is outside of your area of expertise?
So this is 2 things that happen here, because sometimes you diagnose people with a disease. It's going to need certain skill or certain training, or the insurance is going to push you to do it through different people. So most of these people, we have a good network of specialists that we refer to. They are the same caring and taking care of people like we do. And we try to communicate with them so they can take care of patients very quickly and fast.
How is your relation with the hospitals in the area?
We have a good relationship. I go to two of the hospitals, which is Ascension. We have another person who is taking care of people inside Bowman Troy. We have a friend doing it at Henry Ford. So we are well connected to the hospital around the area. So just to answer that, we don't limit people to which hospital they have to go.
Yeah, we have to go.
They can go anywhere and we will take care of them.
Okay, very good. Can you give me an example of a challenging patient or situation that you have encountered?
Yeah.
And how you...
Rafael, the most challenging situation in our culture, because Iraqi culture is very close to the Albanian culture, is diabetes.
Don't tell me.
Because people love to eat.
Yeah.
In our culture, like your culture, a lot of the people, they like food. They have a good kitchen recipes, and they try to implant it. And the idea of implanting it with diabetes is not always good outcome. So most of the challenging is how we convince people to use different things and to take a treatment so they can live better. And I'm proud to tell you that most of my patients, after listening to my advice, if they follow it, they will live a better life than they did before with the diabetes.
With diabetes.
Yes.
So you are specialized in diabetes also, or it's...
I like it because I have a lot of my family who are diabetic, so I'm very interested in that, but I'm not a specialized in diabetes.
Okay.
Yes.
Yeah, you know that diabetes is mostly heredited from my father had, my brother had.
Exactly.
So
it's challenging.
It's a big challenge.
Yes. And the problem with it also is not the genetic, but the cooking.
The cooking.
Because you take it from your father or your mother, which is the same recipe that you use, and also is the same diet habit. So it makes it more difficult for you to get rid of it because you have to change your diet and then you have to change your medication too.
Okay, that's a challenge.
That's a challenge for every day.
So, okay.
Yeah.
Another challenge should be obesity, but they are related.
Yeah, they are related. Now, obesity in the United States is very high. A lot of the people, they try to lose weight. It goes into two factors. The type of food you eat and how much movement you do. Most of the people, they park close to the door of the store. They don't want to walk even into the parking lot. The other people, they even do drive-through to get their food. They don't even walk a few steps inside the store. And that's actually tell you how much diabetes we're going to get. And that contribute to sugar, high blood pressure, high cholesterol, and heart disease.
Okay. How do you handle the patient confidentiality or privacy?
All our staff trained on HIPAA law and HIPAA regulation.
Yes.
So nothing goes there without a legal signature or without a legal approval of the patient. We asked our patient from the day one when they come, who do you like us to disclose information? Is your next of kin, who is next of kin that can get the information from the chart? I mean, we try to be systematic in that so people, they don't get upset about their information. Sometimes even if the wife makes the appointment, we try to get a consent from her husband too for his information. Because last thing you want to do is getting in fight for that.
Can you describe your approach, for example, for managing chronic conditions? It's an everyday job.
Yeah, it's everyday job, but you have to look at it in two views. One, most of these diseases, they have guidelines. So they have guidelines that goes by the insurance, have guidelines go by the professional society for them. But also the guidelines, is not something you need to follow. Sometimes you have to include patient wishes, patient condition, home circumstances in your guidelines. And I'm trying to include all these factors so we can get a better outcome for every patient inside our practice. So it's not like we're like a factory measuring everybody. And also at the same time, it's not like the Wild West that nobody knows why we're doing these things.
What's your opinion or philosophy regarding the use of medication versus other treatments, non-pharmaceutical treatments?
Do you see, Rafael? Here, there's one problem. I'm the kind of guy that I would like if you can treat yourself with food over medicine. Let's do it. I'm not the kind of guy I will deny you getting the medicine. I want you to take the medicine till you reach your goal. But also, as you know, in your culture and my culture, there's some herbal medication, some old recipe. I mean, if it's for cold, I will take it. But if it's for cancer, I will be very hesitant to do it.
Yeah, I understand.
The idea here is this. You try to treat people with respect and dignity and accepting their wishes, but also not by risking their life in doing so. So yes, if you can do something in an herbal way, in an organic way, in a better way, we all for it. But at the same time,
it's not yet approved from FDA.
Exactly. It's not like the FDA approved system of treatment.
How do you support patients and their families in making a difficult medical decision or dealing with end-of-life care for somebody?
I had a special think about that because we ask people about their advance directive, power of attorney, while we talking to them every year and try to update it. So we don't, when we reach that decision, we know to whom you should talk. Second, it depending on the situation, but I try to be honest with patient and upfront with that. You tell them the fact as it is with a kindness. Listen, you have severe heart failure. I don't think you're going to make it this way. But at the same time, you should not go to the hospital every other time. You have to look for your quality of life and you have to enjoy the time that you have. So we try to make it more in a decent way to the people. Yes, there is a formality. People have to fill a form, have to sign paper. But I'm not the kind of guy who will tell you, oh, you should not go into hospice. This is against everybody's wishes. And I was like, no. We have to understand our option. We have to understand and we have to educate our patient about this option. It's for the patient to take which route he wants. And I'm supporting my patient 100%.
Especially in our culture, so hospice is not, we are not used to that.
Oh, you're killing him.
Yeah, we have to keep our older people in the family.
Yes. Which is, as a culture, we're doing much better than average other community outside these, we call them Mediterranean cultures.
Yes.
Yeah.
How do you handle the emotional and psychological aspect of a patient care, especially if it is a chronic illness or mental health concerns?
So mental health and chronic illnesses, they sometimes separated, but the basic idea is two things. Counseling people and more understanding for their problems. A lot of people, they come and ask you, oh, I have fatigue, I cannot sleep. It's underlying depression. You cannot just hand medication for fatigue or sleep. You have to work on the cause of it, which is the depression and why they're depressed. We try to use what they call multi-specialty modules for that, calling psychiatry, talking to psychotherapy, try to get them engaged in that, medication if they need it, somebody from the family, if they approved it and they said, yes, we can open to the family about this, because you're not going to treat depression just by handing the medication.
Yes, medication.
Yeah, it has to be a multidisciplinary approach and it has to be attacked from different places.
And you organize all this yourself to
here in my office.
Various specialists?
Yes, with the care manager and with me.
What do you enjoy most about being a family doctor?
That I see different family and I see the whole families.
Oh, very good. Very good. And do they trust you? Because it is said you tell the truth only to the doctor and to the lawyer.
Exactly. No, my patient, I'm proud that my patient trusts me. I have a lot of my patients, they are 3 generations in the practice. We have the grandma, we have the dad, and we have the grandson in the practice. And that tell you it's a trust had been built over a generation and people. And that's actually most of our work. It's how we do good and people word of mouth bringing other people to the practice. Yeah, that's the main thing,
the word of mouth. What is your impression of the Albanians coming to your clinic?
I have Albanian patients, and as I told you, they carry the same value and culture that the Middle Eastern in general. They try to stick to their family, try to help and respect their elderly. They are a little bit difficult as our patient with the food and diet and how you managing and get. But in general, they are very respectful to the doctor and physician relationship, which is I like. And most of them, they follow the doctor order to the stent we need.
Okay, can you say a word in Albanian?
A word?
Yeah.
They taught me one word. Merci.
Okay. Thank you, doctor.
Thank you, Rafael.
Faleminderit. Dashur teleshikues të televizionit të shqiptarëve të Amerikës, ne i shkëputëm këtu doktorin ton të dashur pak minuta për të mësuar diçka mbi punën e tij, me praktikën e tij, me aktivitetin e tij në ndihmë të komuniteteve të ndryshme në të mes edhe për komunitetin shqiptar. Do takohemi me përfaqësues të tjerë të bizneseve të tjera, qoftë edhe mjek. Thank you edhe një herë. Faleminderit.
Thank you, Rafael.